All right, so today we're gonna have a bit of a conversation about healthcare, and specifically healthcare in the federal as well as in the commercial environment. And so I have some good buddies from iTech AG with me today, and we're going to talk through that. So Nisha, glad to see you, and Gary and Chris. Let's have a conversation about healthcare. We all come from this, and this is kind of our environment. So maybe I'll start with the idea of asset management in healthcare. I know that's something that we've been working on quite a bit, and it's not just IT asset, but then the clinical assets themselves in a healthcare environment. Maybe Gary, you could start with just kind of a conversation. What are some of the things that we're doing in asset management now, clinical and IT?
Well, thanks, Mark. Yeah, recently we deployed a clinical asset management solution at a prominent hospital in the Northeast. We were able to bring in a scalable, modern platform that enabled us to deliver quickly. They had a tight deadline. End of the year, their old system was going to be obsolete, and we were able to just iteratively, bring, a lot of our processes and, an agile approach to, delivering it on time and within budget. And we spent time within, we would, a lot of times call them sprints, but, we did spend a couple hours a week with the client, ensuring data mappings were correct, process flows, use cases, portal requirements, for one of the radiology teams, and we're able to bring it right on time, before the end of the year.
Wow. Okay, so it's interesting. We talk about clinical asset management. I know, having been a CIO in the military forever, the focus was always on how can I track my stuff within facilities, things like that. But you mentioned something really interesting. I kind of want to turn to you, Nisha, if that's all right. You talked about Agile, right? So what are some things that we're doing maybe within the Agile environment, Agile framework here within iTech that we may be able to help our customers?
Yeah, we employ a scaled Agile framework that's essential for government. We've been successful employing that at Health and Human Services as well as some other federal agencies such as DOJ. And what that allows us to do is to react quickly to the changing demands of the public health space, whether it be an opioid epidemic or COVID-19. And we can actually scale up and scale down in conjunction with employing the SAFE framework with a SaaS solution. We're able to scale up and scale down to meet those changing requirements pretty quickly. And deliver a solution with minimal risk and impact to their day-to-day operations.
Can you tell me a little bit about, I'm a little bit familiar with, I grew up in IT, I grew up in the whole idea of waterfall, right? It's okay, I'm going to tell you what my requirements are by the end, but can you tell me kind of how this works a little bit differently now? With, kind of, here's my requirements, I'm going to tell you what it's going to look like, congratulations, go do it, versus kind of bringing in folks in Agile.
Yeah, well, we work with many delivery teams, many Scrum teams who are sometimes working on the same product or same solution, or even other systems in which we need to integrate with. We coordinate our development and our releases on the same cadence, and we're constantly interacting with the federal stakeholders and our product owners to ensure that they're heavily involved in the solution build out. Constantly, they're heavily involved in the requirements, the design, the definition of the solution. They get their hands on the system quickly. With the ServiceNow solution, we're able to nimbly prototype a portal or a GUI in which people can interact with, and then depending on their response or reaction, we can modify it as needed before it goes to production.